Before I begin, I would like to acknowledge on behalf of the board, our CEO, Rochelle Bard, and the CNA staff. We are very fortunate to have such an amazing leader at the helm of CNA and such incredible staff at CNA. As you have noticed, and we will talk more about it, we have accomplished a phenomenal amount. And as president, it would have not been possible without the incredible leadership of Rochelle and the CNA staff. Let's give them a round of applause. I will provide quickly some highlights of the key activities, but I would encourage you to look at the annual report and look at pages 64 and others in the annual report to see of all the work that we have done. And I'm confident that you bookmarked the CNA website and you are up to date on the various issues that we're dealing with. A vast amount of ground has been covered since our last annual meeting. Let me give you just a glimpse. The CNA cross-country tour kicked off in the spring of 2011, and we have had multiple stops across the country and launched the Independent National Expert Commission also throughout the last year, and strengthened the relationship and renewed alliances with healthcare groups and other groups across the country. What each of these activities represent was the board's commitment to, number one, get you engaged in the issues that mattered. And I have said that engagement was extremely important for all of us. Reach out and truly connect with our members, and to position nurses firmly as leaders in reshaping and transforming our country's healthcare system. And we have had a fabulous cross-country tour and fabulous opportunities to connect throughout the last 2 years in many, many occasions. And we truly taken CNA out of Ottawa to across the country. CNA board enthusiastically endorsed a variety of initiatives and strategies to open channels for meaningful interaction among and between nurses, powerful dialogue between nurses and the media, between nurses and public, politicians, policymakers, and other health professionals, and for members to speak out. For instance, we excitedly jumped into the world of social media with launch of the Facebook, Twitter, and YouTube channels in 2011. We saw continued growth in the number of friends, followers, and those who liked and shared our content. What's really great is how we use social media to stimulate two-way discussions on issues that counted. Response to the loss of CRNE is a case in point. RNs from across the country mobilized following the announcement from 10 of the regulatory bodies that they had selected a US-based company to develop a new computer-based RN exam. Through our Facebook and Twitter, and RNs shared their opinion and asked for information about the upcoming changes to the exam. In turn, CNA used social media channels to keep RNs updated. A video message we posted in YouTube in December 8, shortly after the regulator's decision, got over 6,000 views before the end of December. And when CNA issued the first news release about the CRNE in December, we saw a 120% increase in views to the newsroom webpage. A noteworthy example of our reach and engagement. The board also strongly endorsed the CNA cross-country tour. This was an exciting initiative that created many opportunities for those all-important face-to-face meetings that simply can't be replaced. And I'm a strong believer in social media and other electronic means, but let me tell you, the face-to-face cannot be replaced. It has to be part of how we engage and connect. On our tour, we held member assemblies, leaders' dinners, policy dialogue, and visits to real-world facilities where nurses are spearheading incredible innovations. We learned a lot from you. And we took what we saw and heard straight to the top, to premiers, health ministers, health councils. The process was that we would book the meeting with the Premier in the last day, so we actually could speak from our experience throughout the couple of days we spent in the province and share with them our perspective, in addition to bringing the CNA message. And we also took the messages back to the CNA boardroom. Speaking of the CNA boardroom, we faced some changes this past year to the makeup of our board. We were sad to say goodbye in 2011 to our long-standing partner, the College of Registered Nurses of British Columbia. CRNBC has ended its jurisdictional membership in CNA due to the incompatibility between its regulatory mandate as a college and the CNA advocacy mandate. Our board did manage to work out an arrangement to represent BC nurses on the national stage, and we are excited about the presence of the Association of the Registered Nurses of BC at the CNA board table. A number of nursing and healthcare issues grabbed our attention last year: the federal election, reshaping healthcare, defending our publicly funded system. As CNA president, I wrote open letters to political leaders and to you, the members, and I regularly commented in the media on pressing issues. Outreach and activities extended beyond Canada, with CNA's ongoing work to be involved in the international level to advance international health policy to support global health and equity. I led CNA's delegation to the Council of the National Representatives, the governing board of the International Council of Nurses, where we joined nurse leaders from around the world to express concerns about the lack of nursing presence at the World Health Organization and other issues. CNA was invited to the federal government's Canadian Network for Maternal, Newborn and Child Health, which is focusing on the well-being of mothers and children globally. And we hosted an international health research policy roundtable where we discussed nursing leadership in influencing policy. A major effort this year was the board's commitment to supporting and promoting the role of advanced practice nurses. CNA launched a 3-year campaign to create awareness, demand, and support for nurse practitioners' role. Our CEO will tell you more about the campaign activities in her report, but I wanted to share this with you, which was very well received by all across the country. The board took an active role and brought our messages about the value of nurse practitioners straight to members of Parliament and senators during a lobby day on Parliament Hill. The board also saw great value in strengthening CNA's relationship with healthcare groups such as the Canadian Medical Association. Together with the Canadian Medical Association, we encouraged premiers to use our guiding principles in their work on the future of healthcare, and over 120 organizations signed up in support of those principles. No small feat in this country. We are now seeing the result of these advocacy efforts. Early in 2012, the Council of the Federations, which are all the premiers across the country, invited CNA to join its Healthcare Innovation Working Group. It is quite significant. Canada's RNs are officially collaborating with the provinces and the territories and playing a direct and integral role in ensuring health systems provide for the changing health needs of Canadians. Exactly 1 year ago, we launched the Independent National Expert Commission on Healthcare System Transformation. This was a major milestone for CNA's board and the first for nursing. I won't get into the details. I will save that for the Commission when they release the highly anticipated report later this morning. But I would like to say the working and the structure of the Commission were designed with the broad promise of engagement in mind, and you will see that it's been delivered. Before I go into my final comments, I would also like to flag the notion that today is the National Day of Action to protest cuts to the refugees' benefits. CNA has been very active on that file, both with communicating to the federal government and also having representatives in the demonstration and the protests that are taking place in Ottawa. You also can find the current campaign on Nursing Matters, and you can be active on that area, and I would encourage you to continue to lend your voice to this important issue. I would like to close by saying the Board of Directors looks forward to continuing the important path we have set out on to put the health of our profession of Canadians and of the health system above else. We are about the health of Canadians and the health of nursing and how nursing contributes to it. A prime example of our work ahead includes our advocacy efforts, which are happening right now to bring major attention to what we see as a critical issue, namely the federal government's lack of commitment to health, social, and environmental matters in our country. At our board meeting last week, we passed a motion to, and I quote, develop and implement a visible campaign to inform and immediately call to action the nurses of Canada and the public regarding the current federal government's systematic dismantling of the health, social, and environmental policy frameworks and funding in Canada. We are going to send a message loud and clear that this is wrong. It is irresponsible and it is damaging to the health and wellness of Canadians. Right outside of this room is a huge banner lying on tables where you can add your voice to our message. It has lots of space for you to tell the government what you think of their actions. And let me tell you, it's more powerful than have standard messages sent. Tell them to stop retreating on climate change, stop the changes to employment insurance, stop risking food safety and security, restore the health of our nation, and protect the well-being of Canadians. We will keep RNs and Canadians informed about this issue and the implications of the government's decisions. We will create room for discussion and debate and engage the collective power of RNs and the public in taking action. And we have learned the last few months that we know how to do it. Please add your voice to the message today. If you are interested in staying involved in our actions on the issue, sign up for Nursing Matters. Nursing Matters has currently thousands of nurses that signed up because they are interested to learn and be a voice on advocacy. There are sign-up sheets signed beside the banner. Rest assured that CNA will be speaking up and out about the federal government's apparent lack of concern for investing in or supporting healthcare. Unfortunately, given the time frame, I am not going to stop and ask for questions, but we will have opportunities in the afternoon and during coffee time and so on to have dialogues. I would have loved nothing more than to open the floor, and I know we will be at it for hours, but I'm very, very conscious of our timetable, so we will going to defer questions and comments for later on. Thank you very much. This is concluding my report. Rochelle, I now call upon you as CNA's Chief Executive Officer to address the audience.